Welcome, audience. My name is Dr. Rhonda Marie Chakolis. I am a pharmacist and community activist. I am pleased to be here today. These shows are just getting better and better. And before we get started, I always have to say that the views and opinions that I will be expressing do not represent my employers or any of the affiliates. I am so excited to be here today. We have some world renowned experts. And their stories are remarkable. So I'm going to start by letting Dr. Fayron introduce herself and tell us about her project and what you're doing here. Because I'm just sitting here in awe as I'm watching you. And if people could see what I see, your whole team just radiates joy. So
Thank you.
I'm very
Yeah, joy and healing and all of that. But good day, great people. Dr. Fayron Epps. I'm a professor at UT Health in San Antonio. They're endowed chair of caregiving research, but I'm also the founder of the Alter program. And I should say co-founder because I did it with the community. I have a great team, but this program was developed, created, responding to the community. And you may say, well, what is Alter? Alter is a dementia-friendly congregation program, and it's for Black churches. So when I was out there doing it in the community, I am a nurse. I've been a nurse for about 24 years.
wow.
That's a whoa. But and working in the community and spreading dementia awareness, I was hearing that we didn't have resources, and we mean my family, my community. And so how best for us to respond to that is by partnering with the heartbeat of many Black communities, the church.
Yes.
And that's what we're doing with Alter. And we want to shift the way we think about dementia in the Black community because it is attacking our community and we don't know that. I was raised as it was a disease for white people. Even I had it was a nurse with a PhD and still thought that.
Hmm.
And it wasn't until I started digging in the statistics that I seen, whoa, 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 this really impacts us. And we've been seeing this, we just didn't call it the right thing.
Right.
And so now we're partnering with faith communities. I do it across the country. And I'm here in Minnesota because we have six partners,
Six parts.
six partners, church partners here in Minnesota. And I'm excited to bring this work, to bring this support here.
Thank you. And I'm going to have your colleague, Robin, introduce yourself. Just tell us a little bit about yourself.
Okay. I am Robbin Frazier, and I work in the Center for Health Equity and Innovation at the University of Minnesota. One of the hats that I wear that I'm just so grateful for this work is the work with Dr. Epps and the team on Alter. And so I was asked, we were looking for how we could better support our churches. And we were asked to take a look at the altar program. And as soon as we looked at it, the program, and then met Dr. Epps, we knew that we wanted this vital program for our community here.
Thank you for that. How about Janelle? Tell me about yourself, a little bit of your background, and
Okay.
yes.
So my name is Janelle Gore. I am the Director of Community Engagement for the Alter program. I also have my master's in public health from Emory University. I used to work at CDC and the Alzheimer's disease team. Have a lot of experience when it comes to tech and health too as well. So I bring a lot of that background, bringing resources to the community with an organization called MapHabit. We actually just had a session with our churches here in Minnesota where they all were gifted boxes to be able to gift to congregation members who are affected by dementia in their community. And these boxes are filled with different activities for the families to be able to engage with, a part of the Map Habit platform. And then my most recent accomplishment that I'll be engaging in August is I'm going to get my PhD in clinical gero psychology in August at the University of Alabama. So really excited, but a lot of these opportunities, the work that I do really did start with Alter, really did start with a lot of the research that we do within the Alter program too as well.
Yeah, so one thing in health is we use a lot of acronyms. So, Dr. Epps, tell me what ALTER stands for and how did you
Yes.
get here?
But guess what? You're right. We use a lot of acronyms. And so we were intentional for alter not to be an acronym. And so we're playing off of the altar in church. But truly, when we look up what altar means in the Webster's dictionary, it is to change, to shift someone's perception. And that's what altar is here for. When we're partnering with our Black communities, our faith communities, we want to shift the perception of how they look at dementia, their attitudes toward dementia, how they support these families, those living with dementia. And that's what we're here for, is to equip them. So yeah, we tried not to use acronyms. So many
Yes,
people see that, but no, it's really a meaning behind alter.
thank you. Robin, um, Dr. Epps told us about shift. And so you're working in Minnesota in
Mhm.
diversity,
Mhm.
equity, and inclusion.
Yes.
Um, I'm a history person. And so, like, I don't know if you know, Dred Scott decision was decided in Minnesota.
Mhm.
Duluth, Minnesota used to be the lynching capital of the United States.
Yes.
There's that undercurrent of needing for change. And so tell me how you were drawn to alter and how that change and passion has like trickled over into your role.
Okay. Part of what drew me to alter was really seeing how the health of my family and my friends and my community were impacted. I
Mhm.
was seeing lots of people with high blood pressure, diabetes, and then we were seeing the memory changes too with them. And so, what really drew me to alter is I started work at the Alzheimer's Association and just learned that we are twice as likely to be affected by Alzheimer's and dementia, but a lot of times the community doesn't have the knowledge of what is this. And so we often mistake it for normal aging. And so we don't follow up, we don't go to the doctor, but there are things that can be done to help support the people living with dementia. And so I was drawn to Alter because Dr. Epps and the team built three pillars of how churches can help their congregations in their community. And that's doing education and support for the caregivers and the people living with dementia. And then also looking at modifying the spiritual services.
Yes.
And so our churches are making, like Dr. Alter said, they're altering things to be more inclusive. Because often members have been with the church for 30 or 40 years, but then they start experiencing their changes and people are uncomfortable, and that connection gets broken at a
Mhm.
time when families need it the most. So I love the model and the framework that was developed, and I just thought, oh, I just feel like it's been just an honor and privilege to bring it here. And we know the historical power of the church and that it addresses those critical things.
Yes, thank you, Janelle. I think before we started talking
Yeah.
on the show, you started talking to me about your journey and how you've learned how to incorporate innovation. Tell me how that kind of ties into your role at Alter.
Yeah, I mean, when you're working with faith communities, you have to be innovative. Especially when you're working with Black faith communities, because the way that we think about how we would normally work with, I mean, a white population is just going to look different when you go into a Black church. So oftentimes we can't take a lot of the resources, a lot of the educations that we can't take what we have there and just put it into a new setting. It's not going to work. It's not going to land. A lot of people ask, what's the secret sauce? Like when we go out into the community to do different education, to provide different resources. I always say that the secret sauce is us. It's how we present it. It's how we are able to have real conversations. That to me is the power in being innovative in that space where you can be able to connect with somebody simply based on your experiences that you share. I also think a way that we bring a lot of innovation into the program, especially in my role as community director of community engagement, is creativity. So I'm a super duper creative person. I always challenge Dr. Epps with all of my
Yes.
creative ideas. But a lot of the churches get really excited. For instance, in California, one of our churches, I said, well, hey, why don't we have a game night or a game day, and we invite in and we have a Bible bingo. We have I'm also the CEO of of a company called Engaging Beyond Dementia, so bringing in even things that I have in my bag to be able to help and support our faith communities so that they can have additional things that like they might not have access to. But it really comes down to creativity and knowing your community when you're being innovative.
Can I?
Yeah, go
Yeah,
ahead.
right quick. I think thank you for that, Janelle. Yes, you do challenge me, right? But for our listeners, I want you to think, I'm not sure where you may be, if you're on this journey and caring for someone with dementia, or if you're in a faith community or a church. I think it's very important as the Black community that we have to think outside the box. And we've been doing it, but we have to be more intentional about it. Because what has traditionally worked obviously is not working because we still have these disparities in our communities. And it, I always challenge everyone, community members, colleagues, scientists, other healthcare professionals, think outside of the box, or better yet, let's get rid of the box. Let's erase the box and let's think of what truly is needed for us to respond, to meet the needs of our community and to change outcomes. Because, one of the statistics is by 2030, nearly 40% of individuals that would be diagnosed with dementia, such as Alzheimer's disease, will be Black or Latino. That's less than 10 years away. And if we don't erase this box, that's truly going to happen. And so we have to think, what are those things we need to do, starting with our youth, where we can promote brain health activities. Also, if someone is experiencing any cognitive impairment, what can we do to help maintain where they're at, their status? So I'm sorry, I felt like I started preaching. I'm gonna calm down.
That's what we are here to do because that's a message we need, right?
Yeah.
So I'm gonna just take a little bit of a step back and
Yes.
ask, how did you even get to dementia? You're well accomplished, you have lots of letters behind your name, like clearly you could have gone into any field.
Yes.
How did you land on this particular?
I'm gonna just say God directed me here. It was actually family caregiving has always been big in my family. Taking care of my grandparents while in college, and so when I was after my PhD, I was applying for a postdoc, and I was going to do family caregiving, and they told me, no, it's too broad. You need to find family caregiving for what chronic illness. And just so happened, the Alzheimer's Association Facts and Figures was somewhere in my reach. And when I picked it up, I was so shocked when I read the statistic. And this was back in 2013. And this statistic still exists in 2024, that the Black community is twice more likely than our white counterparts to be affected by dementia. And that's what triggered me, because I said, there's no way. I don't know nobody. I didn't learn this in school. But guess what? If they say this is true, I'm going to find these families. And I'm from New Orleans, and I started off in that area finding Black families that were affected by this disease. And guess what? Guess who those families were, y'all? They were my friends that I was hanging out with. They were my co-workers. I had no clue. We go to festivals and parties and we hang out and I work with you every day. And I had no clue you was caring for your mom or your parrain.
Yeah.
I had no clue, but when I started sharing what I was doing, they all came out. And that's what said, wow, this is true. It's just that we keep it silent and we don't want to talk about it because we fully don't understand it. And then there's a lot of myths in the community as, well, maybe you did something wrong in the past and now you have this, or witchery, just you're cursed. It's just so many things we think about in addition to that lack of knowledge. And so here I am. I have taken that on. So that was 2013. And I've been on this journey trying to spread dementia awareness. And now I'm so excited to have a program where I can put resources in our community. So not just making you aware, but what we're going to do
Mm-hmm.
and how we're going to support each other, because it takes a village.
Right. I mean, so again, I grew up in the time where we didn't talk about mental health, or if we had dementia or memory problems, it was part of our suffering experience, right? So, like, just phrases that God doesn't give you more than you can handle.
Yes.
Do not be anxious.
Yeah, don't be, be anxious for nothing. Those things, right? And so I think a lot of that has gotten us to the treatment phase of chronic conditions, right? And what you talked about is some of the prevention stuff. Some people don't even know. Any one of you can comment, like, what do you think or what do you know is causing this disproportionate rate of dementia in our communities?
So I'll speak first. One of the biggest things in our community, as it relates to dementia, in the Black community, communities of color, we experience vascular dementia. We always hear about Alzheimer's disease, but it is vascular dementia. It really attacks our communities. And that's related to our high incidence of cardiovascular diseases, that hypertension, those diabetes that we don't control, that it leads to something else. All of these things related to our heart health, and we just think nothing of it. We're having strokes or small mini strokes, MINI mini strokes, whatever we want to call it, TIAs. We think nothing of that, but not realizing that when that blood flow is not getting to our extremities, it's not getting to our brain neither. And signs and symptoms, what things start occurring in your brain 8 to 20 years before you actually see the signs and symptoms. And so it boils down to a lot of the lifestyle factors, some things that we can control, but also there's some things that's out of our control, because some of the communities we stay in, maybe we can't access healthy foods. Or when we do go to the doctor, we get treated a little bit different. And so to me, it's two-way, right? Some things we can control, but there's also things in the system that needs to change. But lifestyle is really, really big.
Yes. Anyone of you want to
Yeah,
comment?
I mean, I want to just piggyback off of that and just make it more clear about there's a difference between prevention and risk reduction. So oftentimes we get confused about prevention. So I can do things so I don't get dementia. That's not necessarily the case right now. Right now we're really focused on risk reduction. So what can I do to reduce my risk? So Dr. Epps talked a lot about the risk factors for dementia. So hypertension, high blood pressure, diabetes, those types of things. But there are things that you can actively do to reduce your risk. Some of those things that she talked about that sometimes are influenced by social determinants of health, like, where you can be able to have sidewalks or find healthy foods. But how can we also, again, think outside the box? So then what does that look like for me as an individual? Does that mean fruits and vegetables don't always have to come from the produce section? Freezer fruits and vegetables are just as good, if not better, because they haven't even been treated by a lot of the pesticides too. And they go straight from the tree to the bag and they're frozen. So, like, thinking things like that, where I can still eat healthy, I can still even engage in maybe a workout video at my home, inside my home, if going outside my home isn't safe. So it really is us thinking innovatively as a community as we're trying to reduce our risk.
Robin, do you have anything to add? Because I think about risk reduction and some of the stuff that I've talked to you before isn't just some of these clinical things we can do, which is
Right.
why you're in the church. It's about connecting with
Oh,
people as
Yes.
too. So
for
you want
sure.
to
Yes.
comment on that?
One of the things that we know is so important, and this is why the churches is such a great place for us to focus, is maintaining connections with people. And so loneliness and social isolation, the research is there showing the harmful impacts that it has on health. And so, what happens is if people start to experience either physical challenges or cognitive challenges, we tend to, because of stigma or misunderstanding, like Dr. X says, kind of isolate that person. And they stop being included in things. And it is just the opposite of what we need. And so, what we want to do is let people maintain those connections. And the church is a great place for them to be able to do that. And they still need that spiritual part. The one thing that we try to emphasize, people aren't the disease. You know, they're not Alzheimer's or the other forms of dementia. That person is whole and in there, and so you want to be able to support them continuing to do what they can do for the longest amount of time. And so, what we know is having that social connection, what we're eating, our exercise, and also learning new things. And that's part of what we've been doing. And I've been so excited with some of the innovative technology and things that Janelle has worked on, because it is giving us those chances to continue to learn and to grow. And that's what we want to do. We don't want to just be robots and just the repeat. It's learning new things.
So what I'm sensing, Dr. Epps, is a lot of times when I was in school, right? We're risk stratified, right? We're African American. I live in North Minneapolis. I'm a Black woman. All of these things. It sounds like your model really focuses on building capacity and really those protective factors. And I think sometimes when we're in these statistics, and I'll bias this, is that we've normalized like disparities. Sometimes I hate the word because to me, it means it's desperate. We're not going to solve for it. But what I'm hearing from you all is that there is a better way. Tell me how you kind of shifted the narrative and how you got to the point when, especially when you're clinically trained, how did you get to this point?
Well, I think I might have always been, that's how I kind of thought. That's why it was challenging for me to get through school.
Mm-hmm. Mm-hmm.
Because I thought like that. But all of my work is to empower the community and build capacity within our communities to change the narrative. So anyone that connects with me, anyone that wants to partner with me, I am very clear on this is how I operate. And I need you to be on the same page because it takes a village. We have to do this together. And it's very important about building that capacity. And I'm glad you said that because on all of my latest grant applications, that has been put in the title,
Mm-hmm.
building the capacity
Mm-hmm.
of Black faith communities.
Yeah, because I think sometimes, and this is just my personal bias, you know, how we're in school, we use words like empower, right? When we go to our communities, we have the power to change things. We don't need people to hand us these things. We just have to have the knowledge. And so, Robin, if you don't mind telling me how you've used that, how you increase knowledge, especially like working at the University of Minnesota. That can be challenging when you look at, you know, and I'm affiliated with the U, so in full disclosure, but, you know, just some of the historical things that have come out of institutions and people not trusting institutions. How have you navigated those challenges?
Yes. And so we definitely have had people express concerns about being involved with a program or a trial or those types of things. And one of the first things that you need to do is respect that people know the history.
Mm-hmm.
And so, what you don't want to do is say, just be dismissive that, that would never happen with what happened with Henrietta Lacks or the Tuskegee, trial. That would never happen. And so, instead, we talk about how that if what happened, and then I talk about what has changed since then that helps protect people, but also why it is important for us to be engaged, because solutions are going to be developed whether or not we're at the table.
Mm-hmm.
And so one of the things with the altar partners and the churches is they're focusing on that education and support, but they are also focused in on the risk reduction and very open to being involved in clinical trials. I was meeting with our community advisory board, and 3 people were on a trial that I just got involved with. And so we want to erase that myth that Black people don't want to be involved in trials. There's a lot of things that people say as fact, and they say it very powerfully. We were talking about this in the car, but they're not true. But what you need to do is you need to be transparent. You need to respect the people participating in the research. I tell my researchers, I want them to see you in community before you start the study. So we're trying to get that early community engagement at the university, where as that researcher starts to put together the questions that they have, that they early on are getting input for the community. And often they're reviewing material that is going to be done. They're looking at TV, promotion. So people now are getting community feedback instead of at the end and like, what were the 10 reasons that was a belly flop or unsuccessful. When you get community input along the course, you're going to have something that's going to be much more successful, because the community's been involved with doing the solutions. Like you said, they know the solutions. Often it's equipping them with the information, and then
Yes.
co-developing the solutions with them.
Yes.
Right. Janelle, do you have anything to add to all of those powerful words? I'm sure you have something. I see your brain going.
I mean, a lot of it, Robin, you hit the nail on the head. I would just add, are we being represented on the decision making
Yes.
teams? So, who's the lead researcher? What do they look like? Why do they want to be in this work? To me, that's the biggest thing. Because what we don't want is, we don't want good intentions to then have poor impact. And that can do a lot of harm.
Yes.
So that's something that I strongly encourage these institutions, these tech companies, it's not enough for the person who's working with the community to be of that community. The PI, the lead person, it needs to be way more representative. I would even go as far to say, for these other places of power, or not even a power, but these other support roles, that they're also compensated well. I think that's a big thing within institutions, especially higher learning. A lot of these roles that to me are the most important are not compensated well.
Yeah.
Therefore, a lot of times when that work that needs to be done in the community happens, sometimes there's a lot of disconnects, right? Because people only have so much bandwidth. So I think it's kind of that trickle down that we also need to think about as we're having these types of conversations.
And that makes me think about when you say compensation. Sometimes, again, when I'm in community, I can tell people I can never compensate you for your lived experience. I can provide you an honorarium, but I encourage researchers, when you go and write that grant to the NIH, you write that line item in for your community members, and you can get your community members compensated at the NIH researcher level.
And you don't just do bare minimums. So I've had conversations with folks to say, set the standard. If you say you're real serious about getting the African American community involved in whatever the project is, show me with your dollars. Make your money talk.
Yeah.
Because I think sometimes we think like, oh, $30 gift card,
No.
is that's okay. No, we got to push the envelope and really encourage these white institutions to do the same.
So yeah, go ahead, Dr.
No, I was going to say, so when we know everything is not all about money, but we do want to make sure that we invest
Yes.
in our communities, invest into our churches, our community organizations, our people. And, I'm tying it back to altar now. But just making sure that we are, a lot of people, I won't say I'm the only one that started doing this. Other people probably started trying to do this, but they didn't understand what it takes to invest, and realizing that you have to bring financial support. Because again, yes, we have the power, but sometimes we need these other levels of assistance so we can put things in place. And with the Altar program, we do provide financial contributions to our faith communities. We look for opportunities that members of the church can get paid, be compensated for things that they're doing, stuff that they have already been doing. But now we want to make sure we recognize them. And I see that as a form of building capacity.
Yeah.
Well, what I see as a form of building
Okay.
capacity is this beautiful team that you have. It's reflective of me and identify, I see myself, I see my aunts, I see my sisters and my friends. How did you pick this team that you had? How did you come into this team that you have right now?
So I didn't pick them.
Uh-huh.
God sent them to
Oh,
me.
yes, ma'am.
And they are beautiful. And there's no way, if I would have picked a team, no way. I would have, because he knew what I needed to get this moving forward. He knew what I needed to continue to do his work. And so he really sent. So honestly, Janelle, we were on an elevator headed to the same seminar, a seminar I was speaking at, but she had no clue. And we were both lost together. And when I got up to speak, she was like, and she came to me afterwards and was just like, however, I can work with you. I just want to work with you. But that was an encounter in the elevator. And many of my other encounters with my team members, it's just been by that God placing people in my life at the right time and me listening. Even though they may think real innovative and creative, and I'm not that creative, but I have to say honestly, he sent great people to me to continue to move his work forward.
I know I could talk to you all forever, but I would be remiss if I didn't talk about this brochure that's sitting here on this table.
Yes.
That one, it was just wonderful to look at. So if you want to tell me about the conference that you had and
Yes.
some of the things that I was able to look at.
Yeah, so we had our first AlterDementia Summit in Atlanta in April. And this came about because our church partners said, we want to meet each other. We want to engage. We want to learn from each other. And it also came about because I know we have a small team, and my goal is to have partners or churches that are equipped across the country, but we only have so much bandwidth. And so we did this summit to bring in our partners, but to bring in people from all over the country to come learn about what does it mean to be dementia friendly. How can you truly support your parishioners and your communities at large that are on this journey, and also risk reduction. When you partner with us, sometimes that is a lot because we ask a lot of you. But our goal was come to the summit and at least take 1 to 2 things that you can take back to your community, back to your home, back to your workplace that you can implement. And so this was amazing. I want to tell y'all, it was a family reunion. And I didn't know half the people, but once you walked in the building, was held at House of Hope Atlanta with Pastor E. Dewey Smith. It was like family. Like you seen your cousins, your grandmas, your grandpas. Like you was like, whoa. But because we were all there for a common cause, and it was evident in the atmosphere. That's what we was there for. And to have so many faith and Christian denominations come together for this one cause. So I am so hopeful that we will see change in the upcoming years, because we had our leaders at the table. We had Black people living with dementia, caregivers, care partners, all at the table saying, this is what we're going to do. This is what we need. And we are going to be doing it again next year. So we had over 300 people this year for our first one.
Wow.
So next year we are ready, and we'll be doing it again April the 24th through the 26th in Atlanta. Please, we will share information, but you can always go to our website, alterdementia.com, to get updates, to learn about it. But we welcome everyone. You don't have to be a member of a church. You can just be concerned and want to join the movement to come and attend. I'm not sure if any of my...
We also we want people who are funders to be there. We want people who are researchers to be there. We want health departments to be there, because it's a collective effort in order to really be able to address this disease. And that's what was shown at the last one. But I mean, what's our goal? Our goal is 620.
To get over 600 people. And we already have NIA, which is the National Institute on Aging, committed to be a keynote speaker, because guess what? Our community asks for that. They say, wait, they got research out there and we don't know about it. Wait, you saying we can't we don't participate? No, bring them here. And that's what they asked for. And so we're really looking for something to really change and happen at the next summit. And so we can really have some outcomes and we can be part of the solutions, the treatments that are coming out, and that they will effectively work on us and not harm us.
Right. So
Yeah.
let's dispel that myth again, and anybody can
Yes.
jump out there. Let's say it again for the people in the audience. Two things I heard: the myth that you can't work with the church is a fallacy, right?
Yes.
And then I'm also hearing that people want to be involved in clinical trials, but the biggest message I heard is you have to come to our house
Oh,
and
Yeah.
our playground to, because if you want to really collaborate with us, you got to come to us. You got to get to know us. You got to get to know that we're not a patient, we're a whole person. And part of our whole personhood is being involved in community and in the church. I know we're getting close to time here. It has just been so wonderful to be here. I'm going to give you all at least 2 minutes to kind of close it out. And I look forward. Probably what we'll do is closer to um, your event in 2025. We'll find a way to connect via Zoom or something to kind of let people know where you've gone in the last year. Because I think that's one of the things that's missing when we're in research or in academia. People come in and they have something, but they don't tell us what's happened or next steps. And that's what I really admire about your work. So I'll let you go first, Janelle, and let you say your final words and, how you can encourage too while you're here. Because I think for me, and this just is again my own bias, I didn't see myself in academia. So I think somebody out there probably wants to be a MPH, soon to be
Yes.
PhD.
I
Yeah,
say,
yeah.
come. There's a lot of opportunities within academia. Whatever you're passionate about, whatever ideas you have, this really is the space to be able to nurture that, grow with that. Find good mentors if you're gonna be in this space, because you kind of got to grow some tough skin, because it can be crazy out here in this space of academia. But um I just say be your full self and be your whole self, and you'll find a space. And you'll thrive in that space too. I also want to know as well and encourage, well, as we're talking about this conversation of older adults, of dementia, of caregiving, that we also don't forget about our youth caregivers too as well, because there are a lot of youth out there starting from 6 years old all the way to 30 years old who have these experiences of providing care as a child. And we need to be able to nurture them as they're going through this, because they're also developing. And so that is actually in 2025 going to be one of our key things that we focus on. So if you do know anybody who's a youth caregiver, or you are a church who has a bunch of youth in your community, bring them out. We're gonna have a kickball tournament. We're gonna have a good time at the summit.
That's Robin.
Yes, yes. One thing I want to do is acknowledge the Minnesota churches that are a part of the Altar program. And so Pilgrim Baptist Church, Progressive Baptist Church, we have St. Albans Church of God in Christ, Greater Friendship Missionary Baptist Church, Fellowship Missionary Baptist Church, and also Walker West, which is very unique in that they have one of the few African American courses that is dementia friendly and friendly, not only for the caregivers, people living with dementia, or other people that have chronic conditions. And their work and concerts are amazing. And I've just been thrilled that I get to work with the people. They bring that commitment that they want to make a difference. And because our communities tend to be older and they're running into issues like memory loss and dementia, they're saying, how can we help people? And so they attend all the classes. We had 15 people go to the summit. That's 15 people choosing to go from Minnesota down to Decatur. and Atlanta, and be down there 3 days. And so their pastors are supportive. We have ambassadors at each one. And the other piece is I really, when Janelle talks about creativity and energy, two of our churches that are faith partners in Altar presented at the summit. And so we had Progressive Baptist Church talk about what they did in the first 2 years of the program, and then Amazing Grace chorus. They talked about how do you, engage the community in dementia-friendly music and keep people connected. Because one of the things that stays with you the longest is that music, and then they do other programs around it. So it's not only the music, but a time to connect, a time to have good food, all of those. So I really, Minnesota, we go through a lot and have had a lot of changes, but I think it's made us resilient, and we have realized that we are the people that are going to have to come up with the solutions to our community needs. So we're not sitting on a block waiting for somebody to ride in on some horse. We are educating ourselves. This program is inspiring and equipping the churches to make a difference.
Dr. Epps, go on.
Yeah, so I'm gonna close it out. And just to piggyback on that, y'all, we as a people can no longer be silent. This disease, dementia, is attacking our community, and we have to come together. So, everyone that's listening, again, if you're on this journey or you're not on this journey, please consider joining this movement. You don't have to be a partner of with Alter, but think what you can do to support others that are on this journey. Again, we no longer can be silent. We have to speak up about this. It's nothing to be embarrassed about. In order to get help, we need to know what's going on in order for us to help you. If you know a church that may be interested in partnering with us, we're in 17 other states. So this is just not a local program. This is a national program. And this is not just a national program. This is a family that is all committed to the cause. And so we welcome you to join us. Visit our website, alterdementia.com, to learn more about us, and also all of our social media handles, which is Alter Dementia as well. To learn more, again, it takes a village, and we no longer can be silent about this if we want to see change.
Again, thank you all so much. I just want to add my last two comments that I heard from this. One, that stuff that we do where we normalize diabetes, hypertension, those vascular conditions. I think about, what if we told our people that if you don't take your medicine and do that, it's going to affect your brain health? Instead of saying, don't do this, don't eat the salt, don't do, these are things that you can do that can help you and your community. I want to thank you all for being here today. I look forward to having you back. It's been an honor, a privilege. And this is Dr. Ronda Marie Chakolis on For Your Health. Thank you.
Thank you.
Thank you.